Hi everyone. Today we'll learn about drugs for diabetes mellitus. As you know, there are two types of diabetes mellitus. There is type 1 and there is type 2. So, um, type 1 usually occurs in children and it is due to decreased insulin secretion by beta cells. Type 2 diabetes mellitus occurs in old people, old adults. It is due to decreased insulin sensitivity. In this, beta cells are working fine. So, when do we say it is diabetes mellitus? The cutoff is 126 mg per dl. This is RPG, and postprandial is 200 mg per dl glucose. Now, what drug do we prefer in type 1 and what do we prefer in type 2? In type 1, we usually give insulin replacement. And by what method do we give insulin? This can be either given intramuscular, or there are also now many insulin pumps. A monitor is attached to your body, and whenever it detects that there is increase in glucose, it automatically pumps insulin. And in type 2 diabetes mellitus, oral anti-diabetic drugs are given. Now we'll learn about these insulin and oral antibiotic drugs one by one. So first, for type 1 diabetes mellitus, we give insulin. Usually insulin, it is either given subcutaneously or intramuscularly, or insulin pumps are there. Based on each individual, we give 0.1 units of insulin per kilogram of body weight. Insulin, there is rapid acting insulin, there is short acting insulin, intermediate acting insulin, and long acting insulin. So rapid acting insulin, they act within half an hour. Their peak is attained within half an hour. Rapid acting insulin are lag drugs. We can remember this like they never lag. Drugs are Lispro, Aspart, and glulicine. Lispro, Aspart, and glulicine. Short acting is regular insulin. Intermediate is LPH insulin, and long acting insulin are detemir, and glargine. These are the insulin givens. Rapid acting insulin have a peak within half an hour, and long acting insulin do not have peak at all. They act for 24 hours and they do not have any peak. Don't have any peak. Now, oral antibiotic drugs, anti-diabetic drugs. In oral anti-diabetic drugs, first is metformin, the most famous drug. Its mechanism of action is, it is an oral antibiotic drug. Its mechanism of action is it acts by inhibiting AMP dependent protein kinase. It activates It activates AMP dependent protein kinase. It activates AMP dependent protein kinase. It decreases glycolysis, increases um, decreases glycolysis. It increases decreases hepatic gluconeogenesis. It increases glycolysis. Decreases hepatic gluconeogenesis. It increases insulin sensitivity. First group drug increase insulin sensitivity. There are two drugs in it. First is metformin and second we will discuss. Its adverse effect is it causes lactic acidosis and decreases vitamin B12 absorption. Second drug is pioglitazone. It acts on PPAR gamma receptor and increases insulin sensitivity. Its adverse effect is weight gain and heart failure. So we completed first group of drugs which increase insulin sensitivity. Second group of drug which increase insulin secretion. Drugs here are the group are sulfonylureas. Sulfonylureas drugs are chlorpromide and tolbutamide. Chlorpromide, tolbutamide, and first group is sulfonylurea. Second group is meglitinides. Drugs are natiglinide and repaglinide. Natiglinide and repaglinide. Their mechanism of action is they inhibit ATP dependent potassium channel, जिससे कि depolarization होता है, जिससे कि increase calcium influx, जिससे कि क्या होता है insulin secretion हो जाता है. Adverse effect is that sulfonylurea cause disulfiram-like reaction. And other adverse effects are hypoglycemia and weight gain. Third group drugs are those which increase insulin secretion by depending on glucose. These drugs we'll cover in the next video. Thank you.